Okay, let's start with a little mental exercise.
Right.
When I say the word dentist, what's the first thing you feel, like in your gut? Be honest.
For most people, it's a tightening in the chest, a little bit of dread.
Right, it's the sound of that high-pitched drill, the smell of whatever that sterile, clovey smell is, and, waiting to get scolded for not flossing enough. It feels like a chore. At best, a nightmare at worst. It's so transactional. You go in, you deal with it, you pay a bill you don't totally get, and you're out the door.
That's the old model, the tooth mechanic model. You've got a broken part, you take it to the shop, they patch it up, and you leave. It's completely disconnected from the rest of your health.
Exactly. But today, we're doing something a little different. We're looking at a whole stack of material on a practice called CR Dental Group out of North Dallas. And as I was going through their whole philosophy, the bios, their services, I started to think my whole mental image of the dentist might be a bit outdated.
No, this is definitely a different species of practice. When you look at CR Dental Group, which is located right inside Medical City, Dallas, you're not seeing that drill and fill kind of mentality.
Right.
You're seeing what I'd probably call a dental strategy.
A dental strategy? That sounds almost like we're planning a military operation, not just a cleaning.
Well, in a way, you should be. The mouth can be a hostile environment. But seriously, the difference here is between reactive dentistry, just fixing what broke in proactive health management.
Okay.
We're looking at a practice that says it treats the person attached to the smile, not just the teeth.
Which sounds great on a brochure. You treat the person. But does that actually mean anything practical for me, the patient? Or is it just good marketing?
That's the real question, isn't it? But before we get too skeptical, we have to look at who we're dealing with here. This isn't just some pop-up clinic.
Okay.
We're looking at a practice that was just named one of D Magazine's best dentists in Dallas for 2025.
And for anyone who knows Dallas, that is a very competitive market. You can't throw a rock in North Dallas without hitting a medical center.
Precisely. So to get flagged as a best dentist there in a major medical hub, that implies a serious level of peer recognition. It sets a baseline. We're analyzing a top-tier provider.
All right, so let's test that philosophy. The person attached to the smile thing, how does that actually show up? Because I've had dentists who were nice, but I still felt like a number.
I think it starts with the relationship model. In a lot of high-volume chains, the whole business is built on turnover. Get them in, get them out.
Yeah.
But the documentation here on CR Dental Group, it really emphasizes long-term continuity. They're not trying to maximize patients per hour. They're trying to maximize the years a patient stays with them.
So they want to be your dentist for 20 years, not just 20 minutes.
Exactly. And to do that, you need a stable team. You can't build a relationship if the doctor changes every 6 months. The practice is anchored by Dr. Jordana Contrici-Ruiz, Dr. James Reisman, Dr. Monica Goff, and Dr. Alana Reifer. When you have a roster like that, they know your history. They know you have a sensitive gag reflex or that you're worried about that one molar. You aren't re-explaining your life every time you sit in the chair.
That alone makes a huge difference in anxiety levels. But let's get into the nuts and bolts, or I guess the enamel and roots. We usually split dentistry into two buckets, right? The I need this to survive stuff and the I want this to look good stuff, restorative and cosmetic.
Right. And most people think of those as totally separate tracks.
CR Dental Group seems to go heavy on both. Let's start with restorative. This is the foundation, the meat and potatoes.
It is the foundation. And if you look at their restorative services, we're talking fillings, crowns, bridges, root canals, dental implants. The goal is all about function.
Functionality?
Yeah.
It just sounds so boring.
It's boring until you lose it. I mean, think about the biomechanics. If you lose a tooth and you don't replace it, say, with an implant, your other teeth start to shift. Your jawbone itself starts to resort.
Wait, what? Your bone dissolves?
Yes. It actually starts to dissolve away because there's no tooth root stimulating it anymore. It's use it or lose it.
Wow.
So when CR Dental Group is talking restorative care, they aren't just plugging a hole, they're preserving the entire structure of your face. An implant isn't just a fake tooth, it's a reinforcement for your jaw.
Okay, that definitely raises the stakes. So it's not just about chewing your food, it's about keeping your face intact.
Exactly.
Now let's flip the coin, the cosmetic side. They list teeth whitening, veneers, bonding, Invisalign. This is the stuff that gets a bad rap sometimes as being pure vanity.
It does, but that's really a misunderstanding of how psychology and physiology, overlap.
Go on.
Well, let's look at how these two categories blur. Take Invisalign, for instance. Is it cosmetic? Sure, straight teeth look better.
Right.
But straight teeth are also way easier to clean, which cuts your risk for gum disease. And a chaotic bite can cause uneven wear on your enamel, which leads to cracks down the road. So by fixing the look, you're actually doing preventative health.
So form follows function.
And function follows form. A veneer, an implant, it has to look real to give you confidence, but it has to work perfectly so you can eat. They seem to really lean into this idea that looking good and working well aren't separate menu items.
That makes sense.
It's all one biological system.
Speaking of biological systems, I was digging through their specialized treatments list, and I found some things that, honestly, I did not expect to see at a dentist's office.
You're talking about the sleep stuff, right?
Yeah. Sleep apnea. I mean, I know what it is, the snoring, stopping breathing at night, but I always connect that with a sleep lab or a lung doctor, not the person who cleans my teeth.
This is actually one of the biggest shifts in modern dentistry, and CR Dental Group is clearly on the forefront of it.
But why the dentist? Why not a lung specialist?
It comes down to anatomy. Obstructive sleep apnea is often a plumbing problem, a mechanical failure. When you fall asleep, the muscles in your throat relax. For some people, the jaw slides back, the tissue collapses, and it literally seals off your airway.
It's like stepping on a garden hose.
That is the perfect image. It is. You stop breathing, your oxygen drops, your brain panics, and wakes you up just enough to take a breath. And this can happen hundreds of times a night.
Wow.
So, who is the expert on the jaw and the mouth structure?
The dentist.
Exactly. So what CR Dental Group does is create these custom oral appliances. Think of it like a specialized retainer you wear at night.
Okay.
And it gently positions your jaw forward just a few millimeters. That pulls the tongue forward and keeps that hose unkinked.
So you don't need a CPAP machine. No mask.
For many, many patients, yes. This appliance can completely replace the machine. And this is why I say they're acting like oral physicians. If they can fix your sleep, they're lowering your risk of heart attack, stroke, diabetes.
Right.
They aren't just fixing teeth, they are literally helping you breathe.
It goes right back to the person attached to the smile thing. If I'm not sleeping, I'm a mess.
Yeah.
My dentist fixes that, they've improved my entire life.
Precisely. And they apply that same kind of structural expertise to TMJ disorders.
That's the jaw-popping thing.
It's the jaw popping, but it's also chronic headaches, neck pain. Sometimes you can't even open your mouth all the way. The temporomandibular joint is the most used joint in your body.
You use it for everything. Talking, eating.
Yawning, swallowing, and grinding your teeth when you're stressed. If that hinge is off track, it just causes misery. And again, fixing it is not about cavities. It's about the machinery of your head and neck.
It seems like they also handle the immediate crises, too. I saw a note about emergency dental care.
Yes, and that is a crucial point. Tooth pain doesn't wait for an appointment. If you break a tooth or get an abscess, you can't wait 3 weeks.
No way.
CR Dental Group mentions they can often do same-day appointments if you call early. That's the difference between just a service provider and a real care provider. A care provider makes room.
Okay, so they're high-tech, they get the whole body, they can fix your sleep. But we have to address the elephant in the room.
The
fear. I don't care how nice the doctor is. Some people are just terrified, viscerally terrified. And the source material even acknowledges this, saying some patients may experience anxiety.
Some is a bit of an understatement. It's a huge barrier to care. People will literally let their health fall apart because they can't face the chair.
Right.
What impressed me here is that they have a structured solution. It's not just here, squeeze a stress ball. They have a tiered sedation protocol.
Tiered protocol, like levels of being knocked out.
Essentially, yeah. Think of it as a ladder. First rung is nitrous oxide.
Good old laughing gas.
Yep. It's a mild sedative. You breathe it in, you feel a little light, and takes the edge off the anxiety. But you're fully present. Mask comes off. It's out of your system. That's for someone who's just a little nervous.
Okay, but what if I'm more than a little nervous? What if I'm really tense?
Then you go up to rung 2. Oral sedation. That's a pill you take before the appointment. It puts you in a state of deep relaxation. You're drowsy. You're technically awake, but you really don't care what's going on. A 2-hour appointment might feel like 15 minutes.
And then there's the top of the ladder, 4V sedation.
Yes, intravenous sedation. This is a complete game changer for people with severe phobias.
Is that even common in a general dentist office? I thought that was for, like, major surgery?
It is less common, which is why it's a big differentiator here. 4V sedation puts you in a profound state of relaxation, the twilight state. You probably won't remember any of the procedure.
And why is that so important?
Because it completely removes the psychological barrier. If you know you can go in, get an IV, drift off, and wake up with all the work done, you're so much more likely to make the appointment in the first place. It makes healthcare accessible to people who've been too afraid for decades.
It really is. It's meeting the patient where they are emotionally. If you need to be asleep to get healthy, they can do that.
And you combine that with their technology, they mentioned laser dentistry, it just minimizes the whole trauma of the visit.
Let's talk about that for a sec. Laser dentistry. Is that just a buzzword or is it real?
Oh, it's very real. Lasers in dentistry are fantastic. They can treat gum disease, remove decay, reshape tissue.
Yeah.
And they're often way less invasive than traditional tools.
So less bleeding, less swelling.
And faster healing. It's precise. It's the difference between using a scalpel and a beam of light, which, again, plays right into the comfort factor.
All right, let's pivot to the boring but necessary stuff, logistics. If I'm sold on this whole dental strategy idea, where do I actually go?
You are heading to Medical City, Dallas, specifically 7777 Forest Lane, Suite C104.
You know, just being inside Medical City gives it a certain weight. It's not a strip mall next to a vape shop.
No. Being in a major medical complex implies a certain rigor. You're surrounded by specialists. It just reinforces that idea that oral health is medical health.
And I noticed their hours are interesting. They start early.
7:00 to 3:00 p.m. Monday through Thursday.
7:00. I don't know if I want anyone looking in my mouth at 7 a.m. I haven't even had my coffee.
It's actually really smart for professionals. If you work a 9 to 5, getting a 7 a.m. appointment means you get your work done and you're at your desk by 9. You don't have to burn a half day of PTO.
That's a fair point. It respects the patient's time, but high-tech, IV sedation, lasers. That all usually means expensive.
High-quality care is an investment. You can't get around that. But CR Dental Group seems to address this directly. They mention having flexible payment plans and financing options.
Though they work with you on the money part.
They have to. If the goal is a long-term relationship, they have to make the care accessible. Their team helps you find a plan that fits your budget. It lowers that barrier to entry.
So we've covered a lot. We've gone from the dread of the grill all the way to sleep apnea and twilight sedation. If you had to boil this all down, what's the headline for CR Dental Group?
The headline is comprehensive. It really is a one-stop shop. But more than that, it's the integration of it all.
How so?
Most people have a dentist for cleanings, then they get sent out for a root canal, then to another specialist for sleep issues. CR Dental Group has brought all of that under one roof. Gum disease, cosmetic veneers, snoring, it's all there.
So it's bridging that gap between a family dentist and a specialist center.
Exactly. And they're doing it with a philosophy that really prioritizes the human element. That tagline we started with, we care about your smile and the person attached to it, it really seems to be the operating system for the whole practice.
It's a shift from just fixing teeth to enhancing life.
That's the perfect way to put it. When you fix a smile, you're fixing confidence. When you treat sleep apnea, you're not just moving a jaw, you're fixing energy levels, heart health. When you use IV sedation, you're not just drugging a patient, you're curing a phobia. It's healthcare in the truest sense.
Well, if you are in the Dallas area and you've been putting off the dentist because of fear or just feeling like it's a hassle, this seems like a place that might change your mind.
It's certainly worth a conversation.
For those ready to take that step, here are the details. You can reach CR Dental Group at 972-566-4990. That's 972-566-4990. They also have a second line, 972-885-3551. And again, they're right inside Medical City, Dallas.
Just remember, early bird gets the appointment at 7:00 a.m.
Maybe have one cup of coffee before you go.
Agreed.
Before we sign off, I just want to leave you with one last thought to chew on. We started this whole thing talking about dread. But after looking at this, I realized my dread comes from feeling helpless in the chair.
That's completely valid.
So here's the question. If your current dentist is only looking at your teeth and ignoring your sleep, your anxiety, or your long-term confidence, are you really getting health care? Or are you just getting a repair?
Yeah. It's the difference between a mechanic and a doctor.
Something to think about. Thanks for diving in with us. We'll catch you on the next one.